honey, what's wrong?
Someone stole my shirt.
No one stole your shirt. I washed it.
No, you didn't. Someone stole my shirt. I can't find it.
It's downstairs
not
in the
here.
laundry.
No, I can't find it. Oh,
It's in the laundry. It needs to be washed.
why would you wash it? Why would you do something like that? Why would you just come into my room and take my shirt? Ugh.
I will go get it.
Yeah.
You're right.
Hi, my name is Lisa. I'm 16 years old and I suffer from bipolar disorder. Bipolar disorder is a disorder in which a person's mood inappropriately alternates from extremes of elation and depression. Sometimes I can't sit still, I can't sleep restfully, I have pressure to keep talking all the time, I switch from topic to topic, I have racing thoughts and I just can't, I have trouble concentrating. I was recently diagnosed a week ago by my doctor.
Welcome back. Okay, let's talk about what we're up against. Miss Perez, do you have anyone in your family that also suffers from bipolar disorder? Because children with a parent or sibling who has a bipolar disorder are much more likely to develop this illness.
No, not that I know of.
Well, maybe you should ask around because that can cause this disorder.
Well, for now, can you just tell us some things about this disorder?
Yes, of course. Bipolar affects approximately 5.7 million adult Americans, or about 2.6% of the U.S. population at age 18 and older. The average age for bipolar is 25, and it can start as early as childhood or late 40s and 50s.
I honestly don't care. Can we just go?
No. If you don't want to sit here, you can wait outside.
Fine.
I'm sorry. Carry on.
It's okay. I understand. All right. Did you or your husband ever experience ups and downs with your mood? Because a person who has one parent with bipolar disorder has a 15 to 30% chance of having the condition. Also, does Lisa have any identical twins? Because a person who has an identical twin having exactly the same genetic material with bipolar disorder has an even greater risk of developing the illness.
No, but I have a younger son. Is it different with the males versus the females?
Not exactly. An equal number of men and women develop bipolar illness.
My dad left for the Navy when I was younger, so it was difficult for me. I only get to see him like once out of the year. And my doctor said that a life event might trigger a mood of episode in a person with a genetic disposition for bipolar disorder. So that might have caused it. I did a little bit of research and I found out that like back then in like the 1950s the term wasn't really used. I mean it was around but it wasn't really used. It came into more common around the 1980s and I know that it was considered quite rare. Now it's like the 6th leading disability in the world.
Is there a cure for bipolar?
Well, there's no cure, but there is treatment, such as mood stabilizers. That's usually the first choice to treat bipolar disorder. Typical antipsychotics, antidepressants. Also, what would be good is cognitive behavioral therapy, which helps people with bipolar learn to change harmful or negative thought patterns and behaviors.
My family has been trying something called family-focused therapy, and it helps and it enhances family coping, such as recognizing episodes early and improving communication among family members, as well as problem solving. We were going to try this thing called intrapersonal and social rhythm therapy, and it's where it helps people with bipolar disorder improve their relationships with others, and also daily routines and sleep schedule that help protect against manic episodes.
Is there anything else?
Yes, there's electroconvulsive therapy. That's if medication and psychotherapy does not work, aka shock therapy. Sleep medication and herbal supplements.
Okay, thank you very much.
Yes, of course. Lisa's next appointment is next Wednesday.
Okay, thank you.
When I first heard that I had bipolar disorder, I had all these thoughts like, what if people don't like me? I'm going to be judged all the time. I'm going to be on medication all the time. And I was just like, I'm probably going to be handicapped for the rest of my life. So then I just thought, I just have to deal with it. It's a part of me. It's who I am now, and I just have to embrace it.
We're filming our project. This is our actress. There's me, the director.
And I know that it was really quite where